Liposuction can be done on different parts of the body for body contouring. It can be done on the abdomen, it can be done on the flanks, the legs, the arms, the neck, the back. So liposuction is it's a very safe, elective way of removing excess. It's not a weight loss procedure, it's a body contouring procedure. Liposuction is not used to lose weight. It's basically trying to take an area like this and turn it into an area like that. The biggest risk of liposuction is contour irregularities. It's a much bigger problem to have removed too much fat than not to remove enough. We don't want to end up, we want to end up like this, but we don't want to end up with a divot or a contour irregularities. With that, there is always the risk. The technique that I use for liposuction is called the SAFE technique. It stands for separation, aspiration, fat equalization. There's a lot of gimmicks out there in terms of laser liposuction, cool lipo, smart lipo. A lot of those are gimmicky. The biggest thing is the technique that's used. And the technique that we use, which is used by most plastic surgeons, has been established for many years to try and minimize the risk of contour irregularities. What we do, it's called, as I said, the SAFE technique. We go in, we separate the fat under no suction, then we remove the fat, that's called the aspiration, and then we go back in with no suction and redistribute the fat to try and minimize the risk of contour irregularities and make everything nice and even. You'll be in a garment afterwards generally, which it shouldn't be too tight, it should be comfortable. If it's too tight, you need to let us know. It should provide gentle, consistent compression. Not all the fat is removed during surgery. A lot of it's still kind of floating around afterwards. So what'll happen is we're gonna have you generally start massaging it, usually after a week, especially in the shower where it's warm. You could just kind of use circular motion just to gently massage the tissues. You're gonna have bruising, you'll have swelling, which is very common, especially the night of surgery. The liposuction cannulas are inserted through small incisions, which get closed, but it's not uncommon for the fluid that we inject prior to the liposuction to start to leak out, especially overnight. So at that night of surgery, you should sleep on a towel or some sort of pad. But the fluid coming out is not blood generally. It's usually it's like a watery fluid, and just expect that. So as I said, you'll be in a garment afterwards. It takes about 3 to 6 months for the contour to start taking its shape. But there is the risk of contour irregularities. Sometimes we have to go back in and tweak certain things. There's the risk of scarring, even though these scars are small. There is the risk of scarring. Sometimes it's visible. We try and place the scars in areas that are not noticeable, but sometimes the scarring is visible. I recommend after liposuction that you maintain your weight. If you gain weight, the fat can come back. Your body is genetically predispositioned to store fat in certain areas. So if it normally stores it on your sides and you have liposuction there, don't be surprised if you gain weight that you can gain it somewhere else. So it's very important to maintain a healthy diet and exercise afterwards to try and maintain the overall results.